DSM 2D. And today I will be performing the Duppert's maneuver, obtaining the fundic height and fetal heart rate auscultation. So first is we have to assess. Determine the need for Leopold's maneuver, then assess for the client's overall condition, then determine when the client last voided or was this last tested for urine analysis. Then, determine the immunization history, if there are history of abnormal fetal presentation in the family during the pregnancy. Then, the last menstrual period and the expected date of confinement. Then for the planning, allow adequate time to prepare for the procedure. The next is this must be performed during an antenatal checkup. For the equipments have to use is the stethoscope, measuring tape, draw sheet or top sheet, and antibacterial hand spray. For the implementation, check the physician's order to verify the procedure. Then before performing the procedure, introduce yourself and verify the client's identity using agency protocol, then explain to the client what they are going to do and why necessarily and how they can participate. I'm Angela Tolentino, student nurse from NAUSD, and I will be performing Leopold's maneuver, obtaining your fundic height and the fetal heart rate. Next is to provide the client's privacy. Ask the client to empty the bladder before the procedure. Then, perform hand hygiene and observe appropriate infection control procedure. Updating the fundic height. First is to position the client in a dorsal recumbent position, then place a pillow under the head for comfort. Place a rolled small towel or pillow on under the client's right hip. Ask the client to be still with the arms on the side. Then, drape the client with the draw sheet, exposed from the below of the breast to the symphysis pubis. Then inspect the client for the following: scars, dysarthris recti, hernia, linea nigra, striae, gravidarum, contour of the abdomen, state of the umbilicus, and then skin condition. Next is determine the fundal height using the ulnar side of the palm. Measure for the fundal height using the measuring tape. Place the zero lines of the tape on the superior border of the symphysis pubis. Then stretch the tape across the abdomen's contour to the top of the fundus, along the midline. For the Leopold's maneuver, instruct the client to relax the abdomen muscles by bending the knees slightly and do relaxation breathing. Reinforce for the explanations given earlier. Use the flat palmar surface of fingers and not the fingertips during the palpation, and keep the fingers of hands together. Apply smooth and gentle deep pressure as firm as necessary. Then perform the Leopold's maneuver. First maneuver is stand up the client's side and face the client. Palpate the fundus using the both hands. Curve the fingers around the uterus top and feel for the fetal part lying in the fundus. Use the palm palpate for size, shape, consistency, mobility of the fundus fetal part. Second maneuver. Place your hand on either side of the client's abdomen, about midway between the symphysis pubis and the fundus. Then move the hands of the sides of the abdomen. With one hand in a place to steady the uterus, use the other hand to palpate the uterus opposite side with the firm circular motions. Then repeat the maneuver on the other side of the abdomen. For the third maneuver, or the Palbeck's grip, continue facing the client, then grasp the lower abdomen portion immediately above the symphysis pubis, between the thumb and middle finger of one of your hands. For the fourth maneuver, face the client's feet and place your hands palmar surface of each of the side of the client's abdomen. Use both hands with and palpate fetal head using pressing downward gently with your fingertips about 2 inches above the inguinal ligament. Omit the fourth maneuver if the fetus in breech presentation. This maneuver is performed only in a cephalic presentation. Fetal heart rate auscultation. Place the bell side of the stethoscope chest piece on the fetus convex portion, then closest to the anterior uterine wall. Then listen by pressing in firmly and very gently. Count a full minute holding the stethoscope chest piece while the other hand feels for the client's radial pulse. For the evaluation and documentation, document the procedure including the test performed and resulted in the client's record using forms of checklist supplemented by narrative notes when appropriate. Then notify the healthcare facility responsible regarding the results. Inform the clients regarding the findings. Then perform a detailed follow-up based on findings that deviated from expected or normal for the client. Then teach the client to how to do proper follow-up and provide other appropriate instructions. Thank you for watching.